Good morning, Peter Goertz. I'm a psychiatrist. Agitated patients, very frequent in psychiatry. I was working in the hospital yesterday and a patient was screaming. You could hear her from the hallway, a medical floor, and other patients on the floor. I spoke with the nurse, and other patients on the medical floor had been quite upset. They had trouble sleeping at night, and they're hospitalized patients for medical issues. So it's a pretty serious problem, for example, on a medical floor. And that particular patient I had seen previously, and before I saw her, the nurse told me she knows what she's doing. And the patient had said to the nurse, "I'm going to scream until I get what I want." But of course, there can be other things going on additionally. And that particular patient, in my opinion, also had delirium and an underlying psychiatric disorder reportedly. So delirium is a major factor sometimes in agitation, and delirium is related to medical issues or substance withdrawal, for example. And people are confused, they can get agitated. Psychosis can cause agitation. Paranoid people can get very agitated easily. Bipolar disorder, people can get agitated. Personality disorders can lead to agitation. Dementia, autism spectrum disorder, substance or medication withdrawal, even withdrawal from SSRIs can cause some agitation. Simple things also can cause agitation, of course, like if a patient is very hungry, doesn't get food for a while, their food's late, or if the room is too cold, or if a monitor is beeping. Yesterday, I was trying to interview a new patient for us in consultation on a medical floor, and constantly the IV monitor was going beep, beep, beep in both of our ears. Not easy sometimes. We can get agitated potentially. Hopefully not out of control staff. So pain also can cause agitation, or of course it can be a combination of things. Like in the patient I mentioned who was screaming, but also delirious and had reportedly an underlying psychiatric disorder. So when you approach agitated patients, this is not, of course, a comprehensive review, but it's just some thoughts of mine on agitation. So you want to review the medical record, check lab work, head CT if all that's done in the chart, get collateral information from family and friends. If at all possible, address an underlying cause, like, for example, simple things, room temperature, medication withdrawal, substance withdrawal, pain. As far as actual medications for an agitated patient to sedate the patient, Haldol is an old medicine that can be very helpful, an antipsychotic, orally, intramuscularly, IV even, but there's a risk with IV of potential cardiac issues. So we want to be careful, and when you give Haldol IV, the cardiac issue could be QTc prolongation with resultant arrhythmia. Other antipsychotics can also be given, like Zyprexa, Geodon, Thorazine. And when you give the Haldol, you can give it together with Benadryl, which can hopefully avoid dystonia, so Parkinsonian problems. And also you can give the Haldol with Benadryl plus Ativan, potentially. If you really want to sedate a patient, that can be very helpful. And when you give Haldol for an agitated patient, you want to follow the EKG and QTc. And another option we often use for agitated patients is valproic acid. And you can give valproic acid orally, IV. And you want to If you give valproic acid, you want to monitor the complete blood count with platelets. The valproic acid can cause thrombocytopenia, platelet dysfunction. You want to monitor the liver function tests, serum ammonia level, all that you want to keep an eye on if you give valproic acid. If you give thorazine, I tend not to want to give thorazine for agitated patients. It's a pretty significant alpha-1 blocker, so it can cause hypotension, pretty serious hypotension. It's quite anticholinergic, so it can even cause confusion or worsen delirium, for example. And as a last resort in agitated patients, you want to use restraints, which unfortunately often is necessary still. So those are some brief thoughts about agitated patients. Thank you.